Hello, everyone. Thank you so much for hopping on. It's another Talk Chats with you today. If you're a returning subscriber, thank you so much for hopping back. If this is your first time, my name is Ryan Tuminima. I'm a fourth year graphic student and a medical writer and also a content creator, especially on YouTube. So today I have an amazing guest speaker. Today, really amazing. Dr. Linda, could you introduce yourself to the audience?
Hello, everyone. My name is Dr. Lynda. I'm a medical doctor by background, and my experience has been across Nigeria in clinical and public health. But I'm currently working in the United Kingdom as a GP registrar. So in Nigeria, that would be like someone who is in a postgraduate training to become a family medicine consultant. So that's pretty much my background.
Amazing, amazing. Thank you so much, Dr. Linda, for introducing yourself. So we have a couple of questions for you to answer. You ready?
Yes, I am.
All
Let's
right.
dive right
So,
into it.
all right. The first question for you is: what are the most common obstacles busy people face? When trying to make healthier choices, and how can these be overcome? Talk us through.
Right. Okay. Um, this is something I'm very passionate about, talking about health, talking about well-being, talking about ways to make yourself live a healthier and more wholesome life. So once again, thank you for the opportunity to get me to talk about this. So when we talk about busy people, that is referring to people who have got a lot of other things that they have to distribute their 24 hours in a day to. And this doesn't have to just be work. It could be caring responsibilities. It could be school. It could be work. It could be anything that keeps you busy. It could be even chasing or pursuing a hobby that is still in its planting season. So basically anything. Now, what are the common challenges? To be fair, there are so many of them, but for want of time, we'll just highlight a few. The very common one is time. People will say time because then you it's like a pie chart and you have to distribute your time to everything else because you're busy. So finding out that time to do the things that are healthy for you. A lot of people do complain about this and struggle with it. Another key thing is stress. Now, it's easy to think about these things as individual components, but the mind body relationship means that if your mental well-being is not optimal, sometimes it can affect what you're able to do physically. Some physical like symptoms of like someone who's having a mental breakdown would be lack of interest in the things you enjoy doing, or even total lack of interest in anything at all. So it will be really hard for someone who is stressed or having like a mental breakdown to think about exercising. They might know that it's good for them, but in terms of prioritizing it, they wouldn't because currently they are quite stressed, maybe from the environment, their workplace, or whatever is happening in their relationships. So these are two common barriers. Another thing people need to think about as well when you think about barriers could be like if you've got like a caring responsibility. So this is very, very key, particularly for women when we think about childbearing or people who have got kids or even people who have got elderly parents. It might be like a challenge thinking about balancing all of this. And like I said, being busy doesn't just refer to someone who is in a working environment, because I think that that is very um is a very reductionist way to look at it. So anybody who is busy is someone who can be affected by some of these challenges.
Amazing, Dr. Linda. Um, in the first place, I love the fact that you highlighted time as one of the major common obstacles busy people face
Yeah.
when trying to make healthier choices. And also, thank you so much for also talking us through how these common obstacles. I know you said like there are lots of them out
Yeah.
there, but just wanted to highlight this important common obstacles busy people face as well. And thank you so much for talking us through about all these common obstacles busy people find when trying to make healthy choices and how these can be overcome. And I believe that the audience who are very busy with one or two things can adhere to all those obstacles and follow the strategies to overcoming them. Thank you so much for talking us through, Dr. Lini. So that
So in
draws
terms
me
of
to the next.
So in terms of
Okay.
overcoming them, just to stress a bit around overcoming them. Now, when we talk
Okay.
about time, definitely it's hard to think about. You can't increase the 24 hours you have in a day, for instance. It's pretty much what it is, right? So when we talk about overcoming them, it would then be to look inwards. Sometimes people aren't very conscious of how they're spending their time actually. But one way to get your consciousness to what exactly are you putting your time to every day is to keep track. So I would always advise people to start with, first of all, track. Just don't put any pressure on yourself. Track to find out where your time is going. I mean, in this social media era and the digital world, people don't even realize how much time that they're spending while seated and pressing their phones or doing something. You've probably just gone to check an email and then you've got a notification to go on Instagram and you've gone on Instagram and then it's one picture and the other one and the other one and time keeps going. So I would always advise to start with tracking because when you track, you can then see where do I need to take time out of and put somewhere else. And the beautiful thing about it is that it creates that initial awareness. Sometimes it might even shock you to find out how much time you're spending on things that you do not really prioritize. So let's say you find that you're spending 8 hours on Instagram. And if you're a business owner on Instagram, that makes a lot of sense. But if you haven't got any particular thing you're doing there or on any other platform, then it makes you wonder, how can I make this different? And then when you mirror that against what it requires for you to live a healthy lifestyle, let's say, for instance, planning a meal, getting to go some healthy food shopping, cooking up a meal. That will take you about an hour or two, maybe every week. And you mirror that against the recommendation for physical activity, which is like minimum of 30 minutes, 5 times a week. And you find out that this is actually very little time compared to that time that you've been spending very subconsciously. So I would always advise start with tracking. When you track, you can then find out where can you make changes. With regards with workplace related stress, it's not fully within an individual's locus of control because there are things like the kind of people you're working with, the kind of organization you're working with, all of those things that you can't necessarily change. But I would always advise to start with your locus of control. So, what can you control? How can you control the way you're reacting? How would you be able to spot early warning signs that you're being stressed? And when you are being stressed, do you have a coping strategy ready to cope with that? If you see, I'm wearing a green ribbon on my head, and that's because today is World Mental Health Day. So,
Yeah.
and kind of coincidentally, this year is focusing on workplace mental health and well-being. So you need to make sure that your stress levels are being controlled. And this is not to say that people don't get stressed. It's part of life for people to get stressed. Acute stress does happen, but then we don't want it to be chronic. We don't want it to sustain because when you sustain it, it has an effect on even how you're able to hit your health and well-being goals. So you need to be able to find coping strategies that are positive. And if you don't put those positive strategies in place, it's even counterproductive for your health and well-being goals. For instance, people find out that it's when they are stressed that they're eating emotionally. So they're eating all the carbs, all the junk, they're trying to self-soothe with food. And then after a while, they find that they've gained so much weight because they had like a stressful period in their lives. But if you've been proactive to think about, okay, I know that I do get stressed. If I get stressed, what am I going to do then? Is that time to spend more time in nature, to reach out to friends more? Is that time to, make sure that I have healthy food around the house so that I don't just fall into that loop where I'm eating to self-soothe. So yeah, these are kind of some strategies that people might find helpful really.
Amazing, amazing. I love the fact that you stressed further about, work related stress and mental health and how they can overcome them. And I love the fact that you mentioned about tracking your activities on social media. I think there's an app. I can't really remember,
Yeah,
like an app could
there
track.
are lots of apps. There are lots of apps
Yeah,
now that can help you track. And I even think that on Instagram, there, for instance, some of these apps are beginning to even try to improve your digital health like strategies for you in the sense that they might then have like some settings that if you put them on, the app will tell you how many hours you're spending a week or every day. And then I think my Instagram currently puts me off at a particular time as well. So even if I have been on my phone, at some point it just trips me off. I don't know if that's a universal setting, but even if you don't have those settings on, I think it's helpful to begin to not just do it for some apps, but generally every other digital device that you use, TV time, phone time, just making much more awareness about how you utilize your time in a day.
Yeah, yeah. Too. My Instagram do that to me as well. It's just talks to me
Right.
whenever I've over, done a lot of things over there. So
Yeah.
I think we should consider more about those things because if, like, what Dr. Linda said, if you're earning from social media is where, like, your place where you earn money, it's quite different if you spend a whole lot of time there, but it's reverse the case if you don't. There's nothing you're getting off from social media. You're just spending time scrolling on social media, wasting your time. Why can't you even use the time to, invest in other things, like Dr. Linda said? So I think we should consider all those things. So, Dr. Linda, thank you so much for stressing this further on how we can overcome work-related stress as well. And I believe that I know definitely healthy people out there, that are very busy people as well, looking forward to making some amazing choices, healthier choices. I believe that these obstacles, work related obstacles, mental health related obstacles that Dr. Linda shared, and I believe that, they would use the strategies to overcome them. So that drives me to the next question for you, Dr. Linda. How do you approach? Wait, hold on a minute. Hold on a minute. Before I proceed further to this question, talk us through what do you think about social media in terms of people making the healthy choices as well? Do you think that social media does it the right way, or there are a lot of disadvantages about social media, about people using social media to make healthy choices? What do you have to say about that?
To be fair, I think it's neither black or white. It's like everything, it's like most other things on earth or in life where it's about regulation and it's about understanding the pros and cons and weighing them at different points. There are a couple of advantages to social media and healthy choices and, living a healthier life. One is that information is much more accessible. It's much more broken down. It's much more appealing. The formats are audiovisual rather than just going to look for an article to read to improve your health. So you find out that you're getting this information right at literally at your doorstep. That's your eyes. So it's much more available, which is a good thing. You get more inspiration in terms of seeing other people who are on a healthy lifestyle journey or who are sustaining their healthy lifestyle journeys or who have faced challenges and are sharing how they overcame them, which can also be a room for inspiration. You also get to find out like the latest activities, the latest trends, which are fantastic as well. So there are some things that are wonderful about when you think about social media and how it impacts people's health and well-being. You also get a lot of experts and people who might not be experts. So in terms of the cons now is the fact that with this high volume of information, what some people would describe as information overload, it's then key that you're much more critical in your consumption of knowledge, of information about health and well-being, and even in how you set your own personal targets for your health and well-being. So this would mean that if you see content on social media, you might want to find out a bit more. You couldn't just see that when you lick salt for 4 days, you'll get slim, or you drink vinegar for 10 days, you get slim. What is the evidence? Google it, like find out what's the evidence, what are the researches that have been done, and is this working? So you need to be a bit more critical in what you consume. You don't take things hook, line, and sinker anymore. Unlike in the past where information was regulated. So if you're getting something from a newspaper or from a journal, you already know that so much work went into this. So that's one difference. Another thing is the unrealistic expectations people set for themselves. With social media and the digital age as well that we are in, and AI and all of that, you might see a lot of augmented pictures of people's, bodies, structures, fitness goals achieved, that might then put you under a lot of stress to want to achieve in a certain manner, which can be counterproductive because then it can lead you into a full state of inertia. And like, you know what? I mean, all of us are we're all going to die at the end of the day. So what's the point of working so hard for this fitness thing when it will never happen like this? So it's about being conscious of that, embracing your own reality, and finding out that you're your own competition. You're not in any competition with anyone. So set your targets for yourself and focus on getting those targets for yourself. And even from like for busy people particularly, you then see someone who has got like maybe the ideal kind of body structure or weight that you want to attain, or kind of food you want to eat, but then you find out, oh, this person has got all the time they need in the world in their hands, but you're busy, you're 9 to 5er, you've got kids to think about, you've got this and that to do, you've got exams coming up, and like, you know what, I'm not going to do this because look at every other person doing it on social media has got time, but I haven't got time. So you need to distract yourself from that, because at the end of the day, everybody shows snapshots of their lives. You're not seeing the full picture, but you are only having all that access to your own full picture. So you can't judge other people's, pictures with your full picture, because it can never be the same. And then taking away that focus from, oh, I haven't got time, like this projection, but then begin to think about how can I optimize this success. This book, the 7 Habits of Successful People, that successful people will normally focus on what they can control. So rather than focus on what you don't have a control over, like you wish you had more time, but you don't have more time, you've got kids to care about, you've got 9 to 5 job, you've got exams coming up, thinking about what can you optimize. For instance, simple things like if you've got a car, where you park in your work area can make a lot of difference over a long period of time. Instead of parking so close to the entrance, you then begin to park maybe something that will take you 5 to 10 minutes to walk to your office. That way you're getting some walking time that you wouldn't have gotten before. Instead of taking, if you're like in a country with a good busing system, instead of taking your car, you could take the bus, and that way you get some walking time as well. If you've got kids and then you're saying, oh, I'm going to wait till I have time to go to the gym. Why do you have to wait to get time to go to the gym when you can do some workouts at home? In fact, these days I've come across something called Disney workouts for mom and kids. So it's them playing Disney songs, but that way your kids won't be bored, because you all jump into this dance session for about 15 to 20 minutes and the workout is done. So just taking control of what is within your control and focusing less on what is not, is one skill I think that people might be able to use to kind of maneuver some of those cons that come with social media and health and well-being goals. Yeah.
Amazing, amazing, and I believe that the audience are really enlightened about this. Thank you so much for talking to Stu about the pros and cons of how social media affects, people making busy people as well, making healthier choices. Thank you so much, Dr. Linda, for talking to Stu about that. So that draws me to the next question for you. So, how do you approach the simplification of complex health information to ensure that it is accessible and actionable for different communities? What is your take on that?
Right. So I think this from a point of like being a medical personnel, or from the point of being like someone who needs the information. Could you clarify me a bit more on that question?
I think, yeah, as a medical personnel, how do you make
Right.
sure that these informations are really accessible and actionable for different communities? Because I know that people that come across the information you share on social media won't be someone always from the health or
Right.
medicine background. How do you
Right.
do that?
Okay, that's fine. So I mean, for This is quite context specific, um, in the sense that what will work for another context might not work in another context. But as a general scheme of things, it would be kind of making using very plain language as much as possible to describe things. I'm not going to start explaining to you the biochemistry related to weight loss or weight gain, right? I'm going to try to explain it in the most simple terms possible. If you're taking in this much, you have to either lose it somewhere or utilize it in the body. So, keeping the language as plain as possible, that's a link between the evidence and the scientific research to what the layman or the population can consume in terms of information. As much as possible, trying to use less medical jargons where possible. And if you have to use them because you can't find alternatives, it would then be to kind of break it down still. After you've mentioned the word, you then break it down for that to explain. So I think if you follow my Instagram, you'll find me doing that with some words. I might mention a word, then I'll then say that this is this, just to give a bit more clarity. Another thing quite helpful is using pictures, audiovisual guides. It kind of brings it much more closer to the person who is watching or who is listening. Um, and another thing that makes it much more accessible, again, talking about context, is language. So you know that a language might not be the same. Not everyone might be able to understand a particular language. So in terms of context specific, then would be that if you are in a local area, you might then want to make sure that whatever content you're taking out or trying to use to influence healthy lifestyle choices for those people would kind of feature things that are um, culturally appropriate and also language appropriate for them. Because there's no point trying to use language that people cannot understand, basically. Yeah. So these are a couple of things that I think make it much more accessible.
Mm, that was a nice approach, Dr. Linda, on how you simplify, some complex health information to ensure that it is really accessible to different communities out there. Thank you so much. And I believe that the audience are really enlightened based on that. So, before we proceed, do you think that um, when you talked about jargons, medical jargons as well, and breaking down medical jargons to, for it to be more accessible to other, people that are not in the same background, medical background as you. So do you think that works? Because there are people, because, as a medical writer as me, there are sometimes we write things, for a larger audience, right? People are not in the medical aspect or whatever. So I want to know, what are the methods you use to break down these medical jargons? How do you know that this word, for instance, when you talk about hypertension,
Right.
hypertension simply means high blood pressure. So tell me, how do you know that this word is going to be accessible to a different community out there?
Right. Thank you very much for this question. And thank you for actually making it easier by giving me something to explain it with. So one thing, because I was thinking, what am I going to explain this with now? Right? But you kind of made it easier by giving me hypertension. So one thing I commonly do in my practice is use analogies, right? Something that bridges the gap for me and the person who is listening. And for hypertension, I have a very favorite analogy that I use with hypertension. So I'll just share that with you to help you understand. So you say it's hypertension and you tell the person that, oh, it means that your blood pressure is high. And they're like, pressure, blood, high. What's that? You even leave them more confused. So I would normally say, imagine that you've got a pipe, because everybody knows a pipe, the pipe in your house that supplies water to your kitchen and to your parlor. They'll say yes. I'm like, okay. Imagine then that suddenly the person who has the stop lock puts it on so high that the pressure is so high for like a month. What do you think will happen to the pipe? The pipe will be under so much pressure. It will begin to have some cracks inside, some bruising inside, right? Said yes. And then after like maybe 6 months, what do you think would happen? It's one of two things. The pipe would either crack and burst open, or it might even burst open in your kitchen where it's the supply, the end point. Maybe in your kitchen or in your parlor or somewhere. So you come downstairs and you find water, come upstairs and you find water everywhere, right? And I'm saying that's basically what happens with high blood pressure. Now, as people get older, this pipe begins to change. It's a bit firmer, it's a bit more stiff. And then with this increase, with this stiffness, normally it's like a balloon. You press and it's elastic. But with this increasing firmness, that pressure will stress the pipe more, which is your blood vessel. This will begin to cause small cracks, injuries in the blood vessel, which is your pipe. And what we want to do today is think about how we can reduce that pressure so that those small injuries and cracks will not continue. And those points, your kitchen that gets the supply, which in this case is like your brain, your kidney, and your heart, would also not have a case where there is like a burst pipe in them and you start getting like a good water supply, which could be like a hemorrhagic stroke or like a stroke where the blood supply is shut off. And you're like, oh, interesting. So it makes it clearer. Basically, my point is that I use stories to explain it. Stories that you can relate to. And when I find out that this story is not relatable for you, I look for another story, right? So it helps to just keep finding. Sometimes it's easier. You meet some patients, they understand. But I completely agree with you that sometimes you might meet a patient or you might meet someone or a client and it's not clear to them what you're saying. And in that case, I find it helpful to use analogies, things that the patient can relate with in their own context.
Amazing, amazing, Dr. Linda. Thank you so much for clarifying us on that. So the next question for you, Dr. Linda, is what role do you think health or socioeconomic disparities play in people adopting healthier habits, and how can we close this gap? Talk us through.
Right. So this is something very crucial, something that should not be overlooked and ignored because not everyone has the same starting point when it comes to healthy lifestyle choices, right? And in identifying this, you will feel more empowered because then you know what your barriers are. And when you're planning on how to tackle them, you're being more specific and practical. So, for instance, we know already that going by social determinants and health disparities, where people live, where people are born, what kind of education they got, how much they earn, your gender, your caring responsibilities are all things that can affect your health and well-being, even how you make healthy lifestyle choices. We know this is a case, but we do not, we hope that with further empowerment and support and the right information, this would not stand as a barrier between you and your goal. So, yes, health disparities, they play a role in affecting how people take up these lifestyle choices. And an instance would be like if you live, if you find someone who lives like in an environment where they are worried about security or they're worried about, safety, you can't give them a fitness plan to say you need to run at 6 a.m. every morning because you're asking them to go and risk it all. like, you know, so it's, but if being aware of what those barriers might be for you, be it safety around where you live, be it that you are a mom with kids, be it that you're a night shift worker and others work during the day, it helps you plan in a more practical way what will work for you. And it's okay to realize that what works for someone else doesn't work for you. And probably what worked for you 4 years ago doesn't have to work today. So being aware of what these differences are. Obviously, on the larger scale, we talk about what the systems can do, organizations can do to make these disparities better. But I believe that this video is kind of focusing on what is within an individual's locus of control. So I think it's map out what your barriers are. What are those disparities? Is it something you can change? And if so, what can you do to help address them for yourselves? This could also include things like physical disabilities. Some people would only come across workouts that are for people who are standing and running. And they're wondering, does it mean that people who are wheelchair bound don't have to exercise? But that's not the reality. So again, it's about finding what works for you. There currently, with the inclusion and diversity that is going on around physical activity, for instance, we now have lots of resources to help people who are chair bound to do exercise as well. So there are lots of things you can, if you go on YouTube, there are lots of things you can do, even if you're wheelchair bound, or or you've got a very busy lifestyle. You don't have to wait till you're registered in the gym. You don't have to wait for you say, oh, I need to make more money so that I can have a yearly gym membership. You can do something from the house. So it's just having that understanding of what your barriers are and not letting them be an excuse for you not to get to where you're going to.
Thank you so much, Dr. Linda, for talking us through about, the health and socioeconomic disparities, how it plays in people trying to adopt healthier habits and how, we can help to close this gap. And I believe that the audience are really enlightened. So I would really assure the audience to really watch this video to the end because there are a lot of resources. Dr. Linda is really dropping some nuggets that would really not only elevate your craft, also make you choose healthier choices, which is very important, very, very vital to make so that you won't regret your choices at the end because, I've had a lot of speakers who are medical doctors that regret the specialty they chose, so I will really assure you that if you watch this video, there are some resources intact for you, some strategies Dr. Linda, dropped for us that will really, really, help to close that gap of making unhealthy, choices and habits as well. So that draws us to the next question for you, Dr. Linda. So, what strategies do you recommend for maintaining healthy habits for people with busy schedules, especially those in high stress jobs? Talk us there.
Right. Okay. That's a very key question. Hopefully, I'll drop some hints that might be helpful to someone who is in that situation at the moment. So, I normally would like people to look at it in three ways. Where are you at the moment? Where do you want to get to? And how do you get there? So, where you are at the moment in terms of like your diet, your activity levels, and then again, to understand where you are at the moment, you need to track. Sometimes you think, oh, I know. You say, oh, I'm getting so much. I'm adding weight. I'm not feeling like I'm sleeping well, but I'm doing everything right. No, you don't. You don't know if you're doing everything right yet. Let me give you an instance. At some point, I felt, I'm going to use a personal story because it makes it much more relatable. At some point, I felt that I was gaining weight and I couldn't tell why. I felt like I was doing everything right. I was exercising and all of that. And then I was like, you know what, let's take some break and kind of track what we've been eating in recent times. And I went into the shop one day to buy the things I normally would buy. And I walked out of the shop shouting, oh my God, oh my God. I kept on shouting because I went in and I was picking everything I would normally buy and I would look at the calorie and I'm like, wow, like I can't believe that this is how much you have. And this is not even food. This is something I would normally eat like a snack and I will still have my meal for the day. So it shocked me. That's the simple way to describe it, right? So you think you're doing everything right, but you need to actually just track what's going on around you. How much exercise are you getting? How much of what you're eating is good? And even if you think it's good, some people say, "Oh, I've made a swap from eating ever. Now I eat only granola and yogurt." But when you look at the quantity of granola and yogurt they are having, and the quantity of honey in it might even be better than they're eating a bar because it's more of a whole grain, right? It's more of a whole food, right? So it's important to understand. First of all, just relax and find out what's going on around you. That's the first step. And then you then go to the next step, which is, and for tracking, there are lots of apps on Google Play, on Play Store and Apple Store that can help you track what you're eating, right? That's the first step. And even if you say you don't know what calories there are in, sometimes if you're like in Nigeria or in some other parts of the world, the food that you have locally might not all be available on these apps. But you can go on Google and Google. There are lots of resources that have now created the calorie index for these food items. So that might be helpful as well. So basically track. For exercise, we recommend about 75 to 150 minutes of vigorous intensity exercise, or 150 minutes to 300 minutes of moderate intensity exercise every week. So you need to also track and see how much of that you're doing. And then the next step is to find out, where do you want to get to? Do you want to maintain your weight? Do you want to feel more fit? Do you want to lose some weight? Different goals, different goals. And I always tell people, a healthy lifestyle is not just about weight loss. People will say things like, "Oh, I'm a good weight. I don't need to live. I don't need to make all these people's healthy lifestyle decisions." I'm like, no, it's about maintaining. It's about the fact that a healthy lifestyle can be the difference between healthy aging and accelerated aging over time, you know. So find out where you're heading to, what the goals are, and then begin to think about, how do we get there? And when we think about how do we get there, it then brings in things like the initial part of this conversation around, what are the challenges that busy people face? What are the health disparities around you? You bring all of these together and look at it as far, how do we move forward? And to move forward, you need to kind of address these barriers or these problems. For instance, some things I've mentioned that might be helpful for busy people might be trying to slot in more activity into your transportation time. It could be how you get to work or where you park your car when you get to work. It could be for someone who has got caring responsibilities, making workout time a family decision, not a family activity, not just for you. That way you won't be under pressure to find out a time that you can exercise, but rather a time that we all can jump in and exercise. And you're killing two birds with one stone, because you're also then incorporating that habit into the lives of your loved ones and even your children, and they grew up with that habit. Like, I saw my dad running every morning and he hasn't left me till today, because he's left that by example, right? So it's another part to look at. Another thing would be incorporating exercise into like workplaces. So I've currently created this resource called Microfit, Breakfit, but basically focuses on micro workouts that people can do in 5 minutes in your workplace. Break time, for instance, doesn't have to just be a time to snack or eat and gist with colleagues. How about you do some exercises, things you can do from your desk, right? And this is very important because a lot of people actually keep waiting for the perfect time for 15 minutes or 30 minutes. But 5 minutes is better than 0 minutes. And doing that consistently for a long period of time can make a lot of difference, at least with things like your back pain or back muscles, your neck muscles, and all of that. Okay. So these are things I would normally advise for people to do. Find out what your barriers are and
Mm,
look for ways to address them. In terms
perfect.
of
Perfect.
in terms of setting goals, I always advise people to set goals that are smart. You need to be realistic and practical. So when I say set a smart goal, I mean that you're going to set a goal that is specific. Don't set something unrealistic, because it will only make you feel like you're not doing enough, right? You could just say, you know what, this week, I want to make sure that this week I'm exercising 5 minutes every day. Start small so that you don't overwhelm yourself, and then you can build up momentum. You do 5 minutes every day for even a month, it's better than when you were doing nothing. And you can say, you know what, from next week, I'm going to make it 10 minutes. And you do that. And then you keep going that way. You make it realistic and something that you can measure. You can't just say, you know what, going forward, I will be exercising. You're less likely to achieve it than someone who has set a specific goal, saying, going forward, I will exercise for 5 minutes every day. Again, I always recommend that people find support. Don't walk alone, because it can be quite a boring journey. It can be quite challenging. Sometimes you'll be like, what's the point? I'll go to heaven with this pot belly. there's no point really. So it's helpful to find support, people who are on the same journey with you. because it keeps you
Yeah.
motivated. And even when you're having your 12 days, you can have someone
Mhm.
to lean on, and someone that can lean on you when they're having their own tough days as well.
Amazing, amazing. Thank you so much, Dr. Linda, for talking us through about the strategies you recommend for the audience, to maintaining healthy habits for people, with busy schedules and especially in high stress jobs. It could be you're a medical personnel like Dr. Linda. It could be your carer. It could be anything that's really giving you some stress to the high momentum, or you get burned out easily or something. I believe this strategies Dr. Linda dropped for us is amazing. Not only amazing, it could really help you to maintaining not just an amazing lifestyle, but a healthy habit. So, Dr. Linda, we'll come to the last question for you. So, in your experience thus far, how can healthcare providers better address health disparities in advice they provide for them, for their patients? Talk us through. Yeah.
Okay. Thank you very much. So I think this question would kind of pick a leaf from most of the things we've discussed today. Because it covers, it will just go back, kind of summarizing the things we've said. One is being aware of who your patient is. You need to understand them so that you can give a personalized advice. You can't give a blanket cover advice, so that they can use it. Because if they don't, if it's not personalized, they can't use it. Like I told you, you can't tell someone who lives in an unsafe area to jog every morning by 6:30, or you can't suggest to. It will be unrealistic to suggest to a busy mom who has got limited support to be going to the gym 5 times a week, because she'll come back to you and she hasn't done it, and you kind of she will end up feeling overwhelmed because she'll feel like she's not doing what she's supposed to be doing. So it's about making it very, very practical and personalized by first understanding who you're dealing with so that you can, support them better. Next is I like to see patients take ownership. So I don't set the goal for you. I want you to set the goal. I want you to have that when come to realization of what the problem is. What does it mean to you? What does it mean for you? What do you see happening if these things don't change? How would it affect your long-term goals? Let's say your plan is that you want to, attend your daughter's wedding in 40 years' time, dance with her on her wedding day and all of that. How do you see that playing out if we continue with having this problem of obesity and hypertension and diabetes, which we're thinking from what you discussed today could get better if your weight is better managed? So letting them do that self-reflection and self-awareness for themselves so that they can understand their why is better, right? Is quite
Yeah.
helpful. Setting these practical goals. And as much as possible, like we talked about today, trying to breaking down the information, avoiding medical jargons, making it very simple. These are things that I normally would do for people I come across, clients or patients who I'm trying to support. So I think that that's
Amazing.
recommendation
Amazing.
today.
So we've come to the last session of this amazing Med Talk chat with Dr. Linda. So if you love this content, do all to like, share, and subscribe. Thank you so much, Dr. Linda. You've been an amazing guest speaker, and I believe that the audience was really inspired and enlightened. Thank you, everyone. Thank you, Dr. Linda.
You're welcome. Thank you very much for